if you look at the wider the med tech sector that you're in, Eamon, let's call it. Obviously, the pandemic has had far-reaching effects now on that sector. It's probably come right to the forefront, whereas other companies in the travel sector, the hospitality sector, have fallen by the wayside, unfortunately. What do you think that the trends will be this year within your space?
So I think, kind of, hopefully as kind of the vaccine rollout kind of gathers pace, and hopefully COVID becomes less of an issue in time. I think there'll be, like in every industry, there'll be a kind of a focus on what next, how is this going to change how we do things. And I think no matter what industry you're in or what way you work, COVID is going to have a lasting impact. So I think it's very much going to be a look at everything in terms of how public health is resourced, how care is delivered. We feel we're very well positioned in terms of what we're trying to do. That the expert level care that's delivered in the large acute hospitals is going to be more as important as it ever has been. The trouble is, even pre-pandemic, there was huge long waiting lists for care to be delivered. So it's how do we more intelligently divide up the resources and allow patients who are most at need to be seen earlier. So the way that our platform helps healthcare to if someone is stable and kind of their lung disease looks relatively okay, they can have a virtual consultation. They don't need to come into the hospital to use the resources in the hospital. That's good for the patient. It's good for the hospital, because then those resources they can use for patients that do need to come in. And it's being able to understand which patients need to come in is important as well. And we help hospitals with that. So I think every industry and especially in healthcare, it's going to be what are the lessons learned? How do we kind of transform for the future? And I think in the long term we're going to have a better health system off the back of this. So I sincerely kind of believe that, and I think as a public, I think people kind of really kind of appreciate the healthcare and the frontline healthcare workers, and I think we do need to resource it effectively to have a good health service.
Agreed. And I think we've probably seen some of the failings around the recruitment process at the start of the pandemic. I can't remember what the actual tagline was, but that welcome home of healthcare people to Ireland, which fell flat on its face, but it seems to be improving now.